Yeah, connect your video, please. Connect your mic. Neena, connect your mic. Yeah. Okay. Now position yourself properly. Head a little. Okay. Yes. Auto rotate.
Yes, sir.
Yeah. Fine. That's fine. Absolutely fine. Hello and welcome to Seven Sentinels. This is Grandmaster Class and I'm Peter Simon with you. Today we are conducting speaking sessions for the OET students. We have currently Neena Johny from Thrissur, Kerala, India. She is preparing for her nursing specific OET. Yes, Neena Johny.
Yes, sir.
You can start once you are ready.
Okay.
Okay.
Okay. Can I start, sir?
Yeah, of course.
Good morning.
Good morning, nurse.
My name is Neena, one of the registered nurses who is working in this community health center. So could you please tell me your name?
My name is Abraham Lincoln, and you can call me Mr. Lincoln.
Okay, Mr. Lincoln. So could you please tell me the reason behind your visit?
Actually, nurse, I am worried. I am literally worried and tensed. I want to know what the problem is. Can you please help me, nurse?
Yeah, sure, Mr. Lincoln. I'm here to help you so I can assist you. So I know that you are quite nervous about your current problem. So before moving further, can I proceed with you a few questions?
Yeah, definitely, nurse.
Okay. So could you please tell me what bothers you?
I exactly don't know what is the problem, what is bothering me, but I can tell you, I am very, very anxious and concerned. I am experiencing episodes of shortness of breath, trembling, loud heart pounding, chest constriction, and sharp pain. And I can tell you that these last for almost 20 minutes. And then sometimes I don't have any other symptoms, and I can assure you I haven't experienced anything this bad before.
Okay. Thank you for your valuable information. I really understand your concerns regarding your current problems, which called panic attacks. So have you noticed any possible triggers of the panic attacks?
I cannot be sure, but if you consider my feelings, I think whenever there's an approaching exam, I face this problem. And now also in another 2 months' time, I'm going to have an exam, and an important exam coming up in 2 months' time, and I'm really nervous and anxious regarding it.
Okay, so now I get a clear picturizations regarding your current problems. So, these symptoms are quite normal. It's a quite normal response of our body, especially in the students when they're approaching to the exam, such as feeling anxious, nervousness, and fearfulness. However, I can rest assured to you, most of the students in such situations obviously experiencing several psychological issues such as a feeling of anxious like you have. So some of others have fear and nervousness when they approaching to the exam, and our body react those symptoms in different way. So let me tell you detailedly. Some patients may experience chest pain, stomach upset, and some of others may experience loss of consciousness too. But this is quite common, and we can manage it easily by following some of instructions that I'm going to tell to you. Is that clear now?
That's absolutely fine, nurse. And I can tell you, I am really worried. I think the panic attacks might indicate something more serious problem with him.
Actually, this panic attacks does not indicate to something more serious problems. So these quite, I earlier I mentioned that these symptoms are quite common and we can manage it easily. And by yourself, you can manage it easily. So let me tell you some of recommendations for your self-care management. First of all, you need to find some time for yourself and to go to a quiet, peaceful place and adapt to visualize something that makes you more peaceful and comfortable. When you sit there, you can practice yoga and meditations. Both will help you to enhance your physical as well as mental health. Along with that, let me tell you to maintain or practice healthy habits, which include take a adequate rest. It's very important for everyone's health, especially for you, to getting a good relief from the current situations. Additionally, I can tell you is that try to maintain the good habits of eating healthy snacks frequently, which will help you to or enhance your physical health. Moreover that, uh, moreover that, maintain enough sleeps, at least 8 to 10 hours. You have to sleep without any disturbance. It will be provide you a profoundly beneficial for you to enhance your physical health. How does that sound, Mr. Lincoln?
Yeah, that's absolutely fine, nurse. I'll try some
Okay.
of those strategies. And is there
Okay.
anything else that I can do?
Yes, one more thing I would like to tell you is that I would like to advise you to visit this community health center at least once in a week. Here, we provide you exercise for relaxation and breathing in order to overcome your current symptoms related to the panic attacks. Once you follow these instructions, you can see a drastic improvement in yourself. So, is that clear to you, Mr. Lincoln?
Yeah, of course, nurse, I can understand very clear. And
Okay.
I will definitely follow your idea. Weekly visits to the health center sounds to be a good idea. Thank you very much for your valuable suggestion, nurse. Thank you.
Okay,
And I
that's
appreciate
perfect.
your care and concern.
Okay, very thank you, Mr. Lincoln. And I promise you, once you follow these instructions, you can see a better improvement in yourself. And I wish you a speedy recovery from these current issues that you have. So, thank you, Mr. Lincoln. If you have any other queries regarding your issues, kindly ask me. I'll clear all of your doubts. And thank you for listening to this.
Yeah, so that's very nice. Thank you once again, nurse. All right. Now we have completed the role play, and now it's my part to give you some feedback. Firstly, I want to appreciate that you have got a style of your own. That's really good. You're
Thank
improving
you.
gradually. And then secondly, day by day, I can see the progress on a regular basis, I can tell you. But still, some mistakes are there. So we cannot be perfect. So mistakes will always be there, and there's always room for correction and improvement. So let's bother more about these things. Right. Firstly, you said this panic attacks, this panic attacks. You can say this problem or this panic attack. or these panic attacks. These panic attacks. So you can use either plural or singular. This is a demonstrative pronoun, singular. These is a demonstrative pronoun, plural. Panic attacks. Attacks is plural. So these should come. So these attacks. Be very careful. You have a problem with this. The next one. Take a adequate rest. A adequate rest. Take adequate rest. Why a here? A rest, two rests, three rests, four rests. Is there anything like countable? No. Then why are you telling a rest? That means one rest. You want him to have one rest. What do you mean by one rest? I'm not comfortable with your this presentation, this particular part. One rest, does it make any sense? Definitely not. So be careful when you are using this. The next one, moreover that. Moreover that. Why moreover and that? Just say moreover. Why again that? Otherwise, in addition to that. Don't use moreover, same like in addition to that. It's a mistake. So moreover, once you use enough. But in OET, writing, they're not recommending this moreover. Okay, in speaking, it's okay. But if it is not allowed in writing, better don't use in speaking also. You can, okay, no problem, because you're talking to student, candidates, patients, no problem. To some extent, if you have any doubt, you can avoid. Otherwise, okay. Additionally, you can use, okay. Next, moreover that, you said, and immediately again you said moreover that. Did you forget that you have already used moreover? Why are you repeating the word? Why are you repeating the phrase? If you don't remember, if you don't understand what you are to speak next, then what you can do is you just wait. No, why do you want to repeat the things which are already told? Moreover that, what gives? What is the benefit? Just stay silent. It's not a benefit anymore. It's a drawback. So that is called repetition. So just leave it, stop there, think and speak the continuation. And then you said, I, and I. Why so many times you are using I? Are you so much indispensable? Are you so much valuable? I will explain you. I will tell you. I will explain you. I will give you. Why this many times? These many times, I. This much importance to I. Is that necessary? I can tell you very clearly, if not you, somebody else. You're not indispensable. You're talking because you're there, that's all. If you're not there, somebody else will be there. You think no other nurse will be there in your absence? If 10 nurses are not there, then the 11th nurse will be there. So why are you becoming so indispensable? You're not very important. So try not to boast that you are going to explain. I will explain. I will tell. I will. Why this I? So don't show off that you are very important. Okay? Don't show off that you are very important. You are not important. Even the patient is not important in each sentence. You are already there and the patient is already there. Both are already existing. Every particular sentence has its own pivotal point. I will explain the procedure. The procedure will be explained. So don't say I. You need not worry. No, you also. No, you also. You are not important here. Every sentence you is the subject. There is no meaning. Every new sentence starts with a new subject. Otherwise, it is nothing new. Why are you telling the sentence? In one sentence, you will talk about medication. In one sentence, you will tell about exercise. In one sentence, you will talk about diet. Firstly, I will tell you about medication. Next, I will tell you about exercise. Lastly, I will tell about your diet. Why why you? What is important in the first sentence? Medication. First and foremost, medication compliance is mandatory. After that, the second most important thing is regular physical exercise. The second most important thing is regular physical exercise or regular physical exercise. Okay. Participating in regular physical exercises for at least 15 minutes, either in the morning or in the evening or both morning and evening, would be profoundly beneficial. Last but not the least, the dietary regimen prescribed by the dietitian should be followed seriously. Where is I? Where is you? Why I is coming in between? Why you are coming? You is coming in between. Try to fine tune your style. Implement the suggestions given to you in the best possible manner. Then you said a better improvement. There is a better improvement. Improvement means better only, na? A better improvement. Why better here? Why a here? There is some improvement. Improvement is uncountable. Do you say one improvement, two improvements, three improvements, 400 improvements? Do you say like that? Improvement is uncountable. Now let us see what is this countable and uncountable. You go to dictionary and you check here. Improvement, mostly it is uncountable. Okay. Countable or uncountable. But which occasion you have used? Okay. Which occasion you have used? So that you have to check. So a slight improvement, a moderate improvement. Okay, but improvement is already better. So you should know what is countable, what is uncountable. Better to say, for if there is a confusion, you can say there is some improvement. There is some improvement. Okay, right. You can say a big improvement, drastic improvement. Even if you avoid, that's no problem. So improvement. So how you are going? Better. Better means improvement means what? From good to better, better to best. That is improvement. From lower to higher. That is improvement. So you can take that. So improvement is always better only. If it is reverse, it is deterioration of the condition. So there is some improvement, a great improvement. Okay. Right. So these are some suggestions which I give you. Fluency is okay. Accuracy, I have given you some suggestions. Then vocabulary and grammar, then pronunciation. So pronunciation is somewhat okay, but grammar You have to consider all these points which I have discussed with you. And then I've already sent your PDF. Your PDF is already sent to you. Now here it goes. The previous warm-up session. The PDF is here. Yeah. This is the PDF which I have sent you. Now, you know what you have spoken here. If something is mistake, that means either your pronunciation is a mistake or the sentence itself is a mistake. Okay, I have gone through it. Morning prayer. You said morning prayer. Morning prayer. It's not prayer. You have to say prayer. You said prayer. So go through your paper, what mistakes you have done. Everything is very clear. So study this. And when I come for the feedback, final feedback will be like this. Everything is not finished. Now you go through your 2 pages. That's not finished. The final feedback is here. So here it is. Daily routine. Yeah. There it is. This is the daily routine. Now let us see how I am going to correct your feedback. Just like how I did your writing, same like that I'll give your speaking also. Now this is a mistake. So what I'll do, I'll put a red mark. And what is right? Prayer, prayer. So red mark for the mistakes and the blue mark for the corrections and suggestions and improvements. So what are the changes? What are the modifications? So we are going to discuss. Almost we are going to spend one speaking card like this. So be ready for that one. If you are interested, you can get back to me on this. And if you want, I'll give you this feedback. Otherwise, you can go through it yourself. A lot of mistakes, how to rectify those mistakes. So are you interested to get the final feedback, or is that enough for you?
No, I'm interested to get the final feedback, sir.
Yeah, so today afternoon, today evening, okay, or today night, I'll give you this session. Maybe it will go for a 15 to 20 minutes minimum and a maximum of 30 to 40 minutes. So you have to spare that time, and I will give you the timing, and you have to attend that time. So based on my availability, I'll fix the time. If not, maybe in the middle of the night, maybe 10 o'clock, 11 o'clock, after all my sessions are over, I'll give you, because this is a very special session. I don't want any disturbance. I want peaceful situation. So if you can spare that time, you can message me, sir, what time you want to give. I can give you, maybe we can discuss that time. So then once you fix the time, then we can go ahead with that one. Now I am giving you 2 minutes. You can speak whatever you want. The time starts now.
I'm so happy to talk about regarding our classes, because especially this session, because these sessions will provide, actually it helped me a lot to get improvement in grammar session and the vocabularies. So actually I like these sessions very much. Yeah, it's really helpful for me. After the session, usually I go through the YouTube video to find out what I made mistakes. And sometimes I wrote what a lot of mistakes I made while I'm speaking. Then I try to correct everything. So actually, this is very helpful for me, sir.
Right, that's very nice. And guys on the YouTube who are watching this program, thank you for making this a big game and a big opportunity for the others to learn. We are providing the corrections on the YouTube because many students can watch them and any time of any free time, so they can watch and they can learn. And if they are interested, they can get back to me. And if you are interested, you can subscribe for the courses, either speaking or writing or whatever you wish, all the 4 skills. So we have different sessions. The first one is a full-time course, that is 100 days program, that is at 25,000, and which is going to be increased to 30,000 from September 12th onwards. And then there is a 60 days course that is for 2 months, and it is for 20,000. And then we have 1 month course that is 15,000. Okay, and we are already starting the courses here on offline. So the institution started, and if anybody is interested, you can come and join the sessions and participate. This is for the first 1 month. We have the same prices as online, and afterwards it will be 35,000 per month. So if anybody is interested, you can get and register yourself as early as possible, because we take only 12 students per batch. Only 12 students per batch. And then we have a crash course for 15 days and 7 days. And we have individual courses for reading, listening, writing, and speaking, and the comprehensive course for all the 4 skills together. So if you're interested, you can get back to me. You can ping me WhatsApp on +91 98 778 67360. I repeat, +91 98 778 67360. Thank you for watching and making this program a grand success. Have a nice day. See you.